I apologize, the power kind of blinked. So I will start everything over. Start off with the numbers all around West Texas. Amarillo is at 256. Lubbock is at 430. Abilene is at 144. San Angelo is at 41. Wichita Falls is at 60. Midland, our sister city, is at 43. Currently, Odessa is at 60. We have 612 negative cases. Right now, we have 223 cases that are pending. Don't forget, those are from the Madison retirement home, and that is all of their staff, and that is all of their patients. So we have received some back that have been negative, which is great news. So we will continue to wait for those. Some of those have gone to the state, and typically those will take a little bit longer. Usually what they're saying between 5 and 7 days. We do have 28 individuals who have recovered from coronavirus, and we have our 4 deaths. So I would encourage everyone to please keep those families in your thoughts and prayers as we move forward. Give you a little bit of what's going on at Medical Center. They have 3 confirmed cases at Medical Center right now. They have 17 cases that they are watching. These are people that have the symptoms but have not proved positive yet. And they have 177 pending, which, like I said, that's part of the Madison. Medical Center did have 1 nurse that has been confirmed with coronavirus. She hasn't worked in a couple of weeks, so they feel very good about that case not affecting anybody else in the hospital. ORMC currently has no confirmed cases in the hospital. They did release one of their patients yesterday. They got to go home. They have 1 case under investigation, which means they are watching it. And they currently have 4 cases that are pending. So those are tests that we're waiting to get back. I want to talk a little bit about what's been going on in the state and things like that. Talked a lot about it on Saturday, but just in case you didn't get to watch it, the governor came out, had a press conference. Then the governor also had a phone call with all the mayors and all the county judges in the state. And the messaging was a little bit disappointing. He said we could open up all retail, but it's retail to go. You're not allowed to go into that store. Say it's furniture. You're not allowed to go into the furniture store, but they can bring something out to you if you want to buy it. So if it's online, they can bring it out. They can deliver it to your house, but you cannot physically go inside and look at things, which really, in essence, defeats the purpose of opening up some of the retail. So I had a conference call after that with mayors of 7 cities, Amarillo, Lubbock, Odessa, Midland, Big Springs, San Angelo, and Abilene. And we are working on a plan that will allow us to open the communities a little bit faster than what the governor has said. The governor basically said at this end of this phone call, if you've got an idea, send it to us. We'd love to look at it. Which makes me think they may not have a lot of ideas ready to go, but we wanted to make sure we can responsibly and measurably open up the economy. You know, there's been a lot of people that say, well, it's essential jobs versus non-essential. Well, a job is essential if it's your job. It may be a clothing store, but guess what? It's important to every person in that clothing store that they have a job. And so this is the way we're looking at it. We are in the process of also looking at ways to open up, say, nail salons, cosmetology places, hair where you get your hair cut and things like that. But there's going to have to be some rules put in place to make sure we're not spreading coronavirus when we slowly start to open this up. One thing that we will talk about tomorrow night in the council work session is mask and requiring people to wear masks. We may strongly encourage it. Some council members want to make it mandatory. From my understanding, as of right now, the city of Dallas has made it mandatory. In Dallas, if you get caught without a mask, it's a $1,000 fine. I don't know if we want to go that far. I believe in the West Texas people that they'll go along with what we ask them to do. But we're looking at maybe opening everything because we have to get things going now. We have people that are hurting, but we need to do it responsibly and to make sure nobody's going to be sick. Nobody is going to catch it. What happened in Abilene was a little concerning. They had a factory. Many of the factory workers did not speak English, and it was not explained very well to them how to use their PPE or their personal protective equipment. And what happened was a worker would say, okay, I'm finished working, so here's my mask, you use my mask. Well, what happened was the first 80 that were tested positive because a sick person's letting a healthy person use their mask. And so that is things we need to work out. We're going to talk about it at council tomorrow night. We're also going to interview via probably Zoom for the new person for District 1. It's going to be something else that we're going to talk about. I want to talk just a little bit from the heart. If you haven't seen it, you're going to see it. Oil prices have fallen through the floor. The biggest problem we have right now with oil prices is simply demand. China is a huge user of oil. The United States is a huge user of oil. Right now, somewhere between 80 and 90% of all the big jets that we fly are parked. They're not using it. They're not using fuel, which is all petroleum based. People aren't on the road driving around. Buses aren't on the street. Trucks, thank God, are on the streets bringing us food. But one time my parents told me, they said, when you're in a hurricane, everything looks horrible. Wait till the dust settles and then make up your mind on what's going to go next. It's scary when we see oil prices go like this because some of us that have lived here since the 1980s, we understand. We remember those days. Ted Cruz told me that they have had a very heated conference. 13 senators from oil-producing states have told the Saudis that if you continue to flood this market with oil, we are going to start to remove our military assets and we're going to treat you as an enemy and no longer protect you. And they are getting the message. But the biggest problem right now is we've got to get the demand for oil back up. And I believe one of the things that we're going to be able to do with this plan that we're working on is getting people working, getting people driving, getting people back to the gas stations to start using things and catch up. Always end on something positive, and I want to tell you what an amazing job ECISD is doing. Nobody at ECISD ever imagined they would have to go digital and have to teach people, especially kids, online. And I've talked to Dr. Murray, have a great deal of respect for him. And there are parts of Ector County that do not have any type of Wi-Fi, have very little cell signal, and they have actually gone out to find trailers they can put in place to be able to get Wi-Fi to the students that need it. And that is an amazing thing when you see somebody being that progressive just to educate our kids. Our kids are our future. I grew up here. Most of the people I serve with, I've known since grade school. And we can get through this. but education is key. And some of the things they have done, they have talked to and partnered with the Basin PBS. Basin PBS is now actually doing instruction via TV for the appropriate grades. And that was a fantastic idea. School nutrition has served over 500,000 meals to kids that would not have had this food if it wasn't for the school district. That is a lot of food, but we thank God that we have a school system that thinks this much about our kids, that worry about our kids when they do not have food to eat. There is also, for families, I'm going to read this sentence to make sure I get it correct. Our counselors are staffing a family support line available Monday through Friday, 7 a.m. to 9 p.m. at 456-HELP. That number is 456-HELP. A lot of people are having a lot of trouble dealing with this situation. That is a resource that you can reach out to. It's a counselor. They're all certified counselors, but you can reach out and listen to them. Maybe they can say a few things that help you get a little bit different outlook and be able to move on. But that number again is 456-HELP. The ECISD police have done nearly 450 welfare checks on students that they haven't been able to contact via phone, which is another way those amazing people at the schools are reaching out just to check on people. They've also, if you're having trouble connecting your PC, whatever you're using for your child to study, there is a help desk number that has been established by ECISD, and it is 456-0013, and it's Monday through Friday. They'll be happy to help you get your child online, because if you're gray-haired like me, you're probably not going to know how to do it, and this is a great way for them to help. And also, the school nurses have volunteered to help process patients at the Ector County Health Department with the emergency service team. And these are just a couple of ways that your community is coming together to serve each and every one of us. I know it's scary with the oil prices. I know it's scary with coronavirus, but you have people that are working behind the scenes, doing everything we can to make sure you're safe, you're healthy, and that this economy is going to get back on its feet. I've been working all day with the mayors, the 7 mayors, or 6 mayors and myself. I'm going to continue doing that. We do have a meeting in the morning of the city council. We are going to talk about this and look to move forward and start lobbying Governor Abbott and anybody else in Austin that we can get a letter to say, hey, West Texas is different than the I-35 corridor. And also, it's different from the I-10 corridor. And we need to be treated as different, not just scooped in with all of the rest of them. So, from your mayor, God bless each and every one of you. And God bless Odessa, God bless the state of Texas, and God bless the USA. Thank you very much.